So it is Thursday, June 25th, and it is 9:12 a.m. And I want to call the meeting of the Humboldt County Board of Health to order. First thing we'll do is have a roll call. Sheriff Allen.
I'm here.
Dr. Stringham.
I'm here too.
Commissioner Bell.
I'm here.
Commissioner French.
He is not available today, Mr. Chair.
I didn't think he would be. I talked to him last night. So Commissioner Cherry, he told me he wasn't going to be available today. Commissioner Brisden.
Here.
Okay, we have a quorum. The next thing would be, do we have a pledge? Yes, we have a flag. So we'll do the Pledge of Allegiance. If you would please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We'll go to public comment. Do we have anybody in the public that would like to make a comment? If you do, you have to unmute your mic. It'd be *6. And please state your name for the record, and we'll take public comment at this time. Public comment. Hearing no public comment, we'll move to the next item on our agenda, which is an update from the Public Health Officer, Local Emergency Manager, and Public Information Officer on the county response to COVID-19 coronavirus. And we'll go right off to Dr. Stringham.
Good morning, everyone. Can you hear me?
Yes, we
Yes.
can.
Excellent. These are very unique times for the virus, and there's a tremendous amount of change that we're seeing. And so I think this morning I want to focus on changing and readjusting our strategy to more accurately reflect what's going on, not only in the community, but also with the virus. And so essentially when the campaign started, we had no cases in Winnemucca. And the strategy at that time was to attempt to keep this virus at bay, to keep it out of our community. And then we entered a second phase, which was that we were attempting to fight the virus here in the county as soon as it came. And for 5, almost 6 weeks, we entered a next phase, which we were in until just here recently. And we still had no cases in the community at that point, which was really nice. So we entered almost an initial phase where our strategy was trying to keep this virus out of the community like we did in the beginning. Unfortunately, we've entered a fourth phase, and that is we're trying to get the community back, or get the virus back out of the community at this point. We have 2 new cases, and when I last addressed the board several weeks ago, we had 78 cases, and that was the case up until several days ago. And we received our 79th and 80th case here recently, and the FAST team is in the process of working those cases up at this time. One, I don't think is likely to result in any exposures, and the case number 80 is potentially likely to result in other exposures. There have been a fair number of people who've been in contact with patient number 80, and so the FAST team is working on that now. The other thing that's changed is that at one time, Humboldt County had the highest concentration of cases in Nevada. And what that meant in plain language, in addition to having the greatest concentration of cases, was that it was relatively safer to have people from outside the community come in because our concentration of cases was already higher than it was in the early days. I think that it doesn't seem likely that azithromycin, Zithromax, changes the outcome significantly. There are some protocols involving steroids and high doses of vitamin C and a number of other things that are sometimes used. And those do show some promise, particularly steroids, while patients are in intensive care units. And so there have been a number of things in that respect that have been done that likely are also helping to drive that that big number that we all watch, 6% down to 5.5%, that death rate, the total number of people who pass away divided by the number of people who get this virus. And so it's kind of a mixed picture. There's some good news and some not so good news when it comes to the specific medications. One of the things I'm most excited about is a product called STI 1499, which is being worked on in San Diego at a company called Sorrento. And it shows some pretty good promise to give people immunity. And the company feels so strongly about it that they're actually stockpiling a lot of this product prior to receiving FDA approval. And the reason is because they feel very confident that that the product will work, and they're willing to bet by paying for this product and stockpiling the product in anticipation that it will be approved. So we've got some good things on the horizon and some things that we kind of thought would pan out. But the overall number, that 6.0% down to 5%, 5.5%, is actually the thing that I'm most impressed by.
Thank you. Any other questions for Dr. Stringham?
Hi, this is Commissioner Bell. Can you hear me?
Yes, go ahead, Commissioner Bell.
Yeah, Dr. Stringham, I just was curious. It's kind of a personal observation. It seems to me that here in town we have more people than not, like at the grocery stores, that are not wearing masks. And so you have, but I do notice that the social distancing is something that people seem to be adhering to quite well. And I'd say that's just personal observation. I'm just wondering if there's any credence to the mask, because I know there's a lot of pushback on these masks and the governor's mandate. So I'm just kind of wondering what your thoughts are on that.
That's a very good question. So essentially, I think the social distancing is definitely the bigger aspect of what we're fighting. And so if people are willing to social distance, but not willing to wear masks, despite the mandate and some of the other things that we're seeing, then I think it's more critical that they social distance, and the masks are kind of an ancillary importance, important but not as important as social distancing. Ideally, people will do everything. And Commissioner Bell, I'm noticing the same thing. Just a couple of days ago, I was shopping in the evening at Ridley's. I noticed that a number of employees were not wearing masks. In fact, there was only one in the entire store who was wearing a mask, and I was the only patron in the store who had a mask on. And what I think is that in the early days, we were fighting behaviors, we were fighting public education, kind of low learning curve. At this point, what we're doing is fighting complacency and burnout. And I think it's in the human spirit to focus on the biggest of threats. And I think what people have kind of concluded is that we have fewer cases and they can afford to drop their guard. The reason that's such a bad conclusion is because it's very likely that we're going to see a dramatic increase in number of cases. I think that's likely to happen. And to enter that phase already with a complacency and kind of a generalized burnout for doing the right things is a really dangerous way to go. So I think that it's time for us to reinstitute the community volunteer health educator corps. We're using these folks initially to get the word out to some of the vendors, and we had stopped doing that because what we had done had worked, and we didn't think that it was necessary to do these things on an ongoing basis, more of a bolus and maintain type of a strategy. And at this point, I think it's critical that we get the health educators back into the stores and start re-educating people in preparation for what may potentially be a pretty significant resurgence. When you look at the data from the 1918 pandemic, influenza, there was an initial leading edge, which we saw with COVID-19 as well, and then it kind of died down a little bit, and then the second wave was massive, much, much bigger, lasted longer, higher intensity of cases than the first wave, and my hope is that we're not going to see that. Think that the way to avoid that is absolutely by doing the things you've called attention to, making sure people are wearing masks, for the people who are engaged, to engage those people who are not engaged, and to really adhere to social distancing.
Thank you. Any other questions for Dr. Stringham? No other questions for Dr. Stringham? To Captain Sean Wilkin, Humboldt County Sheriff's Office and Local Emergency Manager. Captain Wilkin?
Good morning. This is Sheriff Mike Allen. Captain Wilkin is out on another call right now. Couldn't make it, but before he left, I was kind of idle on the emergency management front right now with the state of Nevada Division of Emergency Management, as well as us here. We haven't seen or had any requests, and we're not hearing. Monitoring that real close to you with the increase in cases. We'll see if there's more guidance coming out of there. To address Dr. Stringham's earlier question for law enforcement about enforcement, right now the responsibility is on the business owners to make available or make sure that people who enter businesses properly wear masks, and also if people are in public to properly wear masks. We haven't received any guidance back from the governor's office or the directive. Usually shortly after the governor does make a speech or executive orders, we receive some emails, but at this point there have not been any emails. I don't know if I did see that the district attorney's office is on the line. I don't know if they've received anything up to this point, but no, we haven't received any further guidance from the governor's office, but the responsibility is going to be placed on the business owners and public in general to be wearing their mask while they're out. Thank you.
Thank you, Sheriff. Any questions of the Sheriff this morning?
This is Anthony Gordon at the DA's office. I would concur with Sheriff Allen. We haven't received a word either from the governor's office or anything regarding the directive.
Thank you, Anthony. Any other questions or comments? Okay. Hearing none, we'll move on to Nicole Maher, our Public Information Officer, regarding the current status of Humboldt County response to the coronavirus. Nicole?
Can you hear me?
Yes.
Okay, perfect. Good morning, everyone. I just wanted to touch real quickly on the Silver State International Rodeo that Dr. Stringham mentioned. The Winnemucca Convention and Visitors Authority, I don't know if you saw that in the newspaper, but they put out a very nice guest commentary, just encouraging our community to welcome these folks and to do the right things. On the flip side, we, working with Dave Mendiola and Kim Peterson, have sent out a letter to businesses, hotels, motels, restaurants, gas stations, grocery stores, things like that, encouraging those businesses to really put their best foot forward. Of course, the event will have health screenings and sanitation and social distancing, and Dr. Stringham will be following up on that with Kim. But we want to make sure that our businesses put their best and safest foot forward and make sure that in addition to just helping these people feel safe and comfortable in our community, as Dr. Stringham said, we also want to make sure that we are protected and that our community does not see any adverse effects from this. So good things happening with that, and we'll look forward to that. The Humboldt County School District received some guidance yesterday from Nevada Department of Education. They issued a guidance memorandum for the 2020-21 school year, and districts will be required to adhere to emergency directives and public health protocols and any guidance that comes from NDE. In a nutshell, schools are going to need to open under phase 2 guidance, and so the district sent out a survey to all parents to begin that process of gathering information. And that survey included parents' feelings about having their children wear masks and having their children socially distance and participate in activities. So it will be quite a process, certainly for the school district to meet those guidelines, and it will be interesting to see how that rolls out and how parents feel about that. I wanted to report that the Mucka mask makers at Robertson told me that they have now reached 6,000 masks, 6,001 to be exact, and some sewers are planning to continue to sew over the summer. And so with this updated guidance from the governor, we continue to have masks available. Those are just readily available at the Ridley's Pharmacy and at Olson's Pharmacy in Clarice. And of course, people are welcome to message the mask makers over their Facebook page. As Dr. Stringham mentioned, we are seeing some COVID complacency. That's what we're calling it, with some people doffing their masks. And so on my part, just continue to hammer that message home. And certainly as we've seen a very slight uptick in our community, but still a bit of an increase, and still want to make sure that people are doing their part to stay safe. It's interesting that just to remark a little bit more on the governor's call for people to wear face coverings. He called for people in public places, and so I looked that up a little bit more, and the governor defined public places as restaurants, grocery stores, public transportation, pretty much any business. He did give some exceptions, those with medical conditions that have trouble breathing, those with disabilities that don't allow wearing a facial covering, and children between the ages of 2 and 9. And so up until this point, we've really just concentrated on children under the age of 2, but he's brought that up to age 9. The governor encouraged businesses to ask patrons to leave if they are not following face covering rules, including, which I thought this was interesting, covering both the nose and the mouth. I think we've all seen, I know I have, I've been in businesses where people have facial coverings on, but it's not covering their nose and their mouth. And as the sheriff has confirmed, there will be no criminal penalties for those who do not follow the rules, but certainly it is strongly recommended, and so we will back that up in our community as well through our communications. Governor Sisolak went on to say during his speech on Wednesday that any discussions of moving to phase 3 have been tabled due to continuous rising numbers over the last 4 weeks. It was interesting, the governor cited one study that showed that incorporating social distancing alone, which, as Dr. Stringham said, is great, and if that's all we can get, we'll take it. But he said just social distancing alone without universal masking pretty much leaves this virus in a state of just, we don't know what's going to happen with it. On the other hand, that same study showed that when at least 80% of a population adopts universal masking, there is a substantial reduction of infection. On the other hand, when only 50% of a population masks, it's not sufficient to prevent continued spread. So as Dr. Stringham has told us from the very beginning, both are just critical in this fight. We need people to wear masks, and we need people to socially distance. Speaking of numbers, the state saw some pretty significant records this week. On Friday, there were 410 new cases. So just to give you an idea, we usually see somewhere in the 250s on a daily basis. So 410 on Friday. That was usurped by Saturday, 445. And there have been about 10,000 new tests since Sunday. So we are seeing a substantial increase in testing. And since Sunday, partly as a result of that increased testing, but also the government is saying because of family and social gatherings, there have been about 1,500 new cases over the last 4.5 days, 8 deaths. In all, Nevada is up to 495 deaths, so we're just shy of 500. Now, Elko is just blowing out at the seams. spoke with my counterpart in Elko, and she just said, wow, just not sure what's happening over there, except that their testing has been much more comprehensive than it has been in the past. In the past, Elko has definitely been using presumptive kind of strategies as opposed to testing-based strategies. And so just I went back and counted, and since about the first of the month, around June 3rd, Elko has had 58 new cases, and currently Elko stands at 79 cases, so they're just right behind us. Lander has gone up 9 cases since we spoke last week, from 23 to 32, and Pershing is up 1 from 5 to 6 cases. That's all I have for today. I'm happy to try to answer any questions. Thank you.
Thank you, Nicole. Does anyone have any questions for Nicole at this time? I have to say that I thought it was interesting in the governor's speech last night that the directive for the face mask was, as you covered, they were to be worn over your mouth and nose. And I don't think that was part of the directive the first time.
Yeah, I agree.
Any other questions? Any other comments? Okay, we will move on to the next item. Overview of statewide COVID-19 impact. The presentation summarized the impact of COVID-19 from a statewide perspective. I think we just did that. Is there any other comments on the statewide perspective? No? Okay, well, we have down here testing update, consideration, discussion of possible action regarding specific plans for antibody testing and ongoing community testing in the months ahead. Dr. Stringham already alluded to that. Do you have any other information that you want to give on that, Dr. Stringham?
I don't. I'd be happy to answer any questions if people have specific questions about the antibody testing.
Mr. Chair, Dave Mendiola. Dr. Stringham, I do have a question. So if an individual citizen is contacted by another citizen who, and we had something like this just recently in the county, and was told, hey, listen, we were hanging out last week, we were working on a project together, and I found out that somebody close to me tested positive, and I just wanted to let you know that. What should someone do in that case? And let's assume for a moment that while they did have contact with the person, they kept their distance, and maybe they even had masks on, but let's assume that they didn't, but they did keep their distance. What should one do? Should they go directly and ask to be tested? Or again, assuming they're asymptomatic, should they just wait? So that was a question that came up just recently, and they were told that, yeah, you really should have waited a few days versus coming, like the next day or 2 days later.
No, I think that there are a number of different things that we really should be doing. So theoretically, if a person is in contact with somebody who becomes known to be infected subsequent to that encounter, theoretically that person who contacted the person should be contacted by the FAST team themselves within a pretty short period of time. But as you say, in certain cases, there are people who become aware more quickly than the FAST team would be able to contact them. And so in those cases, my preference would be that anybody who's been in contact present to us, that they contact us. And there are a number of different ways that can be done. It can be done either through the hospital, through calling Humboldt General Hospital. It can also be done through calling the Elko hotline. That's the other option, because they'll patch that person through to our FAST team also. That's kind of the way that works. And there are a number of other ways that that a person would be able to come to our attention. But the critical thing is that if a person is wearing a mask and treating everybody as if they're potentially infected, then these cases become of less concern. And the case that you're talking about, I'd become aware of that through you, of course. And so when the FAST team did the research and was figuring out what was going on, there are a number of different people who'd come in contact with case number 80, and many were not wearing masks. And there specifically was one individual who was supposed to be in respiratory isolation and was not. They specifically disregarded the respiratory isolation order and were actually in the community, and that kind of contributed too. So I think that the strategies as we move through the process, the first strategy is avoidance, to make sure that universal precautions are being used by all people at all times, so that these things become less dangerous. And then the second is to make contact. If a person finds out or has a reason to suspect that they've been exposed, the best thing for that person to do is immediately isolate themselves and make contact with officials at earliest convenience, so that we can decide kind of what we want to do. Ultimately, those people should be in contact with members of the FAST team, Ken and Debbie Whitaker and Griselda Soto. And so those would be the things that I would do, because this person does not have symptoms yet, and they take that to mean that they can afford to wait, they potentially would be infecting other people. And so the primary strategy is avoidance. And the best way to do that is by early identification and making sure that people self-quarantine before they even develop symptoms. And then we can always release them if it turns out that it wasn't the real thing, or there really wasn't much of a problem.
Thank you.
Thank you, Doctor. Tiffany, are you on? Tiffany, are you on the call today?
Mr. Chair, I do not see Tiffany on here. I will, if you don't mind, comment at this time. I did speak with Karen Cole, CEO of HGH, and she wanted to pass on that they are there to assist the county, the city, as well as the staff of fairgrounds during the SSIR rodeo, and they too are concerned, with the large influx of visitors coming to our community from surrounding states where the virus has kind of blown up. And so she just wanted to let everybody know that they're there to help anything they can do. They're happy to do it. They're geared up staff-wise. But of course, her bigger concern was not what will happen over the weekend, but what kind of influx we might have of the virus in the next couple of weeks due to all the folks being in town. So, but in any case, again, she offered any assistance from the hospital that we needed.
Thank you, Dave. She had called me this morning too. I'm glad you reported on that. That was kind of what I was hoping to get from Tiffany, as well as any information on their new antibody testing equipment and tests that they had ordered. But we'll maybe have that on the next.
Actually, I can comment on that too.
Okay. If you would, please.
You bet. I talked to Dr. Mardini. He's the hospital's pathologist, and did that this morning. And the hospital will be in receipt of a new machine, and the machine will have the capacity not just to do fast antibody testing, IgG and IgM, which are the long-term and short-term antibodies that indicate recent exposure and remote exposure. And so his anticipation was that should be coming fairly soon, but that it hadn't been received yet.
Okay. Thank you, Dr. Stringham. Mm-hmm. Any other questions concerning testing? Okay, no other questions. We'll move on to the next item, which is discussion regarding frequency of the Humboldt County Health Board and health meetings. Consideration, discussion, possible action to change the Humboldt County Board of Health meetings to a biweekly schedule. Who would like to take on this first? Mr. Mendiola, you want to talk about that?
Yeah, thank you, Mr. Chair. Dave Mendiola. One of the things that precipitated this agenda item was the fact that we had seen such a reduction and or a flatlining of our new cases. And in addition, there was very little activity on the emergency management front through Captain Wilkin. And so we had talked about at least putting it before the board to see if there was an interest in, rather than doing it weekly, going to 2 weeks. The current schedule would, if we went to 2 weeks, then that would put us a week after the SSIR, or a few days after the SSIR. But in any case, that I just wanted to put that out to you. And then by the way, Mr. Chair, I have one other item that I just want to mention, and I can do that during public comment. So, but that's what the agenda item is intended for.
I would like to have comment from the other board members. What your feelings are, Dr. Stringham?
I think that it would be reasonable to do that. I agree exactly with what Dave said, that the circumstances have changed, and even though we're kind of in a potential ramp-up phase, we're not actually in that ramp-up phase yet. And so I think that the issues are all defined. I think we all kind of know what we're up against, and so I think that if other members feel comfortable going to once every 2 week program, I would be supportive of that too. I think we could always change it if we had to. If the circumstances reaccelerated, we could potentially go back to a weekly meeting if we had to. But at this time, I don't think it's warranted. That it doesn't seem like things are happening fast enough at this point to warrant weekly meetings.
Thank you. Sheriff?
I would agree also that every other week will be sufficient at this time, and then if things start to increase again, we can always go back to weekly. Thank you.
Thank you. Commissioner Bell?
Yeah, I'd have to agree with the previous comments, and every 2 weeks would be just fine. We're not doing a lot of action, it's more informational. And that information is still readily available out there. So 2 weeks is going to work for me as well. Thanks.
Commissioner Brizenden? You want to comment on that, Commissioner Brizenden?
Sorry, I had to unmute. Yes, I'm fine with every other week as well.
Okay, thank you. Could I get a motion from someone?
Commissioner Bell, I'll make a motion to move our meetings to every 2 weeks as opposed to every week.
Okay, we have a motion on the floor. Is there any questions on the motion? No questions. All in favor, please say aye.
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 Aye. Okay, we will be having our meetings on an every 2 week schedule. So that will put our next meeting date at, what day is that? The 9th of July. And so that'll be the 9th of July at 9 o'clock.
Mr. Chair, Dave Mendiola, also, and just keep in mind, if something were to happen and we had some kind of a blow up or need to meet, we could always still do it, I believe, under the emergency management declaration. I'll clear that with Wendy to be sure. But I think we still have that option if necessary. I can't imagine what would precipitate that, but if necessary, we could.
Thank you. Do we have any future agenda items other than adding the minutes on there?
Mr. Chair, Dave Mendiola again. So two things. You had requested both the minutes as well as Tiffany Love commentary from the hospital perspective. I was remote during that last meeting, sent myself an email, but I sent it to the wrong email because I'm working off of two right now. So that did not make it on the agenda, but we have already added that for the new meeting, so.
Okay, anybody have any other items they want put on the agenda for the July 9th meeting? Hearing none, we'll go to public comment. Mr. Mendiola, you had something you wanted to say there?
Yeah, public comment for Dave Mendiola, for the record. We have been talking about the county offices opening primarily here in the courthouse and the annex building. And I just wanted to make mention that one of the things we are considering is continuing to have our single point of entry through the sheriff's office ramp area there. And we are looking also at manning that door with an individual, probably through manpower, which will be covered by the CARES Act, the cost of doing so. So that somebody, potentially we're looking at taking temperatures at the door and also offering masks to individuals who come in. That way we can control the flow and make sure that we at least offer those or mandate that those masks be worn now that we've got the governor's dictate. And so I just wanted to let the public know that when we do open the offices, original plan was to open all the doors. But again, just so that we can control it a little better and at least offer those services, i.e. the masks and the like, we'll do that through a single point of entry.
All right, thank you, Mr. Mendiola. Any other public comment out there? If you have public comment, please unmute your mic, be *6, and state your name for the record. We'll take public comment at this time.
Commissioner Tipton, this is
Yes.
Tom Haas.
Go ahead, Tom. Congratulations.
Thank you. I appreciate that. I've got a whole bunch of concerns over this. First of all, it's been mandated by the governor that we all wear face masks. Second of all, you're supposed to keep it under 50 people in a meeting. As far as I know, it's still being upheld. You don't have a way of enforcing the mask anywhere. The governor doesn't even have a way of enforcing them. Now, Dave just come up with the idea of opening up the courthouse, which I think it should be. They want a single entrance, they want temperature testing, they want all of this kind of stuff to make sure that, or try to make sure that there's nobody that's sick is coming into the courthouse to protect the courthouse workers. What about the Silver State Rodeo? There is no controls whatsoever. Are they going to have a single entrance? Are they going to test every one of them coming in as far as temperature is concerned? Who's going to enforce a mask to everybody that's there for several days? And Dr. Stringham just told us that the biggest fear that there is right now is people coming into Winnemucca and spreading the virus to us from outside the areas. I do know this, that people outside of our area are traveling, are using our facilities and bringing, the possibility of the virus here. So why is Humboldt County in there doing a big rodeo when they are in fears of themselves getting infected in the courthouse, plus bringing in the virus worse to Humboldt County? Why are they opening it up and having a rodeo and when they can't control it? Anybody that would like to answer that, I'd appreciate it.
Mr. Chair, Dave Mendiola. Tom, thanks for the question. Like some of the things we talked about today, when we were looking at the possibility of the SSIR going on as planned, we presented that before the governor's LEAP group. One of the members of that is J.J. Goycochea, commissioner out of Eureka County. And so we actually reached out to Kim Peterson at SSIR. We requested a plan from there with protocols by which they could limit exposure, make sure that distancing was in place. They put together a plan. I've got that somewhere. I'm happy to share that with you. I'll get an email address from you and I can share that with you. But so they went on beyond that. JJ worked closely with them, as well as the LEAP group, which included several other people around the state, and the governor's office. So that was cleared through them. They felt like the protocols were in place to do everything you can. Now, again, anytime you have a large group like that, you just can't control all of it. But the goal is, the majority of that is an outdoor event. And so we are closing off parts of the grandstands so that, we can keep people apart. But so having said that, that was at a time when things were mellowing out and, we had leveled off. And now, of course, the rest of the country, and especially our outlying states, where the majority of these people are coming from, had already, been in good shape and had not had these massive influx of the virus. And so things have changed, just as Dr. Stringham said. So now, obviously, we have greater concerns. And so, but the only thing I would say is we have talked a lot with Kim and his staff, with the SSIR promoters, and talk to them about them establishing individuals, whether it's participants and or staff that are helping run that operation, that they're all really responsible to be supervisors, if you will, of their families, the guests, as well as the participants, of making sure that everybody's doing the right thing to the best of their ability. And it's really up to everybody. So in the end, I can't remember. I got to be honest with you. I don't remember whether they were going to test for temperatures and that type of thing. With a larger crowd like that, it may or it may not be possible. But in any case, there have been a lot of efforts into trying to put some protocols in place. And I was telling, I think, Karen Cole this morning, as we were discussing this same thing, that my concern is not the first couple of days, because I think everybody's well aware of it. I know SSIR folks have made all of the guests who are coming into town very much aware that this is a huge testing ground to see if we can pull this off. I'm not worried about the first 2 or 3 days, but I'm really concerned about the 4, 5, 6, and 7. Because as people get comfortable and they don't follow up, that concerns me. But again, I think one of the things, I'll be speaking pretty much daily with Kim, and we're going to try to do everything we can to continue to remind people through public address announcements during all of the events coming into the facility. And they've got protocols with the vendors as far as distancing and that type of thing. So there's no guarantees of anything, but I think they've done a really nice job at trying to think it all through. But in the end, it's up to the individual people who attend to really make it happen.
Thank you, Dave. This is Tom House again. How many people are coming in, do you think?
Well, I believe the number is 540 some contestants. So you can assume that, these are high school kids, that they're going to have a support staff, a family, et cetera, of 2 to 3 each. So you're looking at 1,500 people or so coming in. And so that's a pretty large number. Now, a good number of those actually use the RV grounds that are out at the fairgrounds. Of course, many others will be staying in hotels and frequenting our restaurants and the like. And again, that to me kind of goes back to the same issue. If our local businesses are doing the right thing and mandating not only that their employees are doing the right thing, but making sure people are wearing masks and asking them to do so, I think that we can mitigate some of the problem. But in the end, we really got to have the help of people to do the right thing.
Well, we just got through discussing through Dr. Stringham that the right thing, as you call it, isn't being done here, even at home. You say that the businesses aren't wearing masks even themselves, and it's up to the businesses to enforce that. Now, why would it be any different for this? And you're bringing in, say, 2,000 plus people. The chances of us bringing the virus to Winnemucca at this point in time, according to the stats today and according to the governor yesterday, there's an awful chance that we're going to infect Humboldt County even worse than it ever was.
Yeah, again, I can only go back to the fact that this decision was made and the go was given several weeks ago. So, and a lot of things have changed.
Okay, it was done several weeks ago. Okay, and I agree with the stats at that time. It was looking good for us. It was actually getting less concern. People were not getting infected and different stuff. Yesterday, day before or whatever, we get this doom and gloom from the governor, and we see the stats from the outlying states and stuff around us, and that's changed. Okay, that in itself has changed, and then Humboldt County is going to put on, and Humboldt County is going to sponsor this. It isn't that an individual has gone out and say, hey, I'd like to put on this rodeo. We can't even go bury our dead. We can't do anything here yet to allow us, to be out and about. And we want to bring in 2,000 more people at this time. I think it's not something that you should be doing.
I'd like to caution you that this is not an action item. This is a public comment. So go ahead, Tom, if you have more.
No, I'm done. It's not an action. The public comment is before and after, and nothing can change anything in the meeting. So there's nothing I can do about it.
Thank you. Is there any other public comment?
Hello, this is Lori McCurry. Can you hear me?
Yes, go ahead,
Hello.
Lori.
Hi, I'm with Nevada Gold Mines Turquoise Ridge Mine, and my question is for Dr. Stringham, just clarification, because we hear that over in Elko County, they've been doing quite a few of the rapid tests, and then they've got a procedure that if a rapid test comes back positive, then a confirmation test is, and this is where I'm a little fuzzy, if there's a confirmation test done or if that test is then sent off for confirmation. And then with that, the recommendations for people to self-isolate during that period of time, if there's a standard. Because what we're hearing, and again, this is hearsay, and so just looking for confirmation, is that if someone comes back presumptive positive on the rapid test, negative on the rapid test, that they're still advised to self-quarantine or self-isolate for an additional 72 hours. And then if not symptomatic, then they'd be cleared. And in our case, what I'm looking for is return to work. And if you've heard of that or addressed that, and what your recommendation is around continuing to self-isolate, when people should be tested or not, and what's the standard around the community in Winnemucca of recommendations. What we do is if we have anybody that has answered yes to the CDC questions, family members that are symptomatic themselves, that are symptomatic, or if they've been exposed to a confirmed case, we ask them to follow up with healthcare, and then based on their advisement, are tested. And we've seen where some have been immediately told, yeah, go in and test. Others have said, in the past was self-isolate for 14 days just because of the potential exposure or symptoms that are going on. And then others just recently where a person had a high temp went down, and they talked to the healthcare and they said, no, you don't need to be tested, but stay home for 7 days and then you can go back to work. So it's all very confusing to me right now.
Yeah. Lori, thanks for your question. First, I received your text. Thank you very much for your assistance and all the support that you've given in the past, and really appreciate your assistance in addition to the question. And so I think the reason that you're a little bit confused is because, admittedly, it is kind of confusing. I think that the basis of the confusion is that there are a lot of different recommendations that are made. Our set of recommendations, depending on county and depending on time, tend to change and almost make this more of a patchwork than a cohesive group of recommendations. And to be honest, even for me, it can be difficult to kind of stay abreast of things. Number one, at certain times in the past, tests have been in short order, and so that's kind of confused things a little bit. Also, Elko County has tended to do things a little bit differently from the way that we have, and their advisor there has primarily worked with presumptive positives during much of the campaign, and then they've just recently moved to more of a test-based strategy, as I think Nicole Maher had alluded to also, as it's been talked about in the past. And so they have a wonderful advisor, and he came up with a great strategy in the early days when we didn't have as many tests available. And so that's one of the issues. Second issue is that there's a difference between a person of interest and a person who's confirmed to be positive. And then the third issue is that the rapid tests made available by Abbott is a great test. It's a very high quality test. It's fast. It's easy to use. But the one downside that's somewhat disturbing is that some studies have shown inaccuracies of up to 30% in certain cases, meaning that in certain cases, it's not capturing people who actually have that virus. And it seems to be less good at that aspect of the assay than it is at ruling out the fact. In other words, if a person has a positive result, then it's likely that that's believable. Whereas if a person has a negative result, depending on how the test is done and a number of other issues, it can be false. That cannot be accurate. So from our standpoint, we try to be as accurate as we can be in a world where a lot of the information that we get is not accurate. And so to kind of walk you through the process, that so far what I've done is kind of outlined the reasons why coming up with protocols, with policies is challenging, but then to kind of nail down what I think, which is really the spirit of your question, give us some guidance and let us know what's really going on here. And so first, if a person has symptoms or comes to attention for any reason, because they've been exposed or this person becomes a person who we want to test, from the time that person is tested, they're ordered into respiratory isolation. So for send-away tests, the nasal swab, the PCR test, it's going to take a couple of days before those test results come back. And by definition, the person you're testing has some probability of having the virus. We don't want those people to be exposing other folks prior to finding out that the test result is positive. And so as a result, we order those people into respiratory isolation from the very first day that test is done. So immediately on testing, they're in respiratory isolation. If the test is negative, then that person can be released. But in the interim, there are people who have already been exposed to that person in many cases. Those people are also ordered into respiratory isolation. Now, the part that's a little bit confusing, admittedly, is that if a person is tested and the test result becomes positive, but that person already has contacts with other folks, and those people are also in isolation. When that test result comes back positive for the initial person, that initial person is released and their contacts are also released because the threat does not appear to have been real. The reason that some municipalities do confirmatory testing is because the nasal swab PCR test, kind of the send-away test, is still more accurate than the rapid test. And the reason that the rapid test is generally believed is because there's just suggestion that it may not be as accurate as we'd like it to be. There are certain studies that indicate that it actually is fairly accurate. And we've seen no cases in Humboldt County where a test has been negative and that person has been shown to have gone on to infect other people. So it's one of the things, it's a constantly evolving program. And I'm always monitoring our results and learning new things so that we can kind of change our policies. In terms of returning people back to work, the reason that's a little bit confusing is because we've had about 4 different iterations of a return to work order, and it's likely that there will be a 5th iteration here over the next couple of weeks. So the first iteration was that we weren't retesting people because we didn't have enough tests. So if somebody was known to be positive, the CDC was telling us, send these people back to work at 7 days. And that always gave me the chills, to be honest, because we knew that there were cases, and even the CDC admitted that that they knew that there were still people who were infectious at 7 days. They knew that. Then they moved to 10 days in hopes of capturing a few more of these cases. And the reason they did that initially was because there weren't enough tests to retest people. And then eventually they went back to that strategy after they had tests that they were doing to confirm people were no longer infectious. But then we learned that those follow-up tests would sometimes be positive because they were picking up non-infectious viral particles that were still being shed by the patient. And so what we learned is that following up with a PCR nasal swab test, if the test was positive, it didn't necessarily mean people were infectious. We've had one case that was positive for 6 to 8 weeks. In fact, I think it was 8 weeks finally when this woman finally stopped showing positive tests. And she was probably not infectious after about 10 days. So we've gone to the most recent iteration, which is people who are positive, who've demonstrated a positive test. We keep them in isolation for 15 days beyond the point where they're tested. Now, the CDC recommendations are from the point that the symptoms start. My personal recommendations have been from the date that the test was done, and the reason is we've had some people who maybe the nice way to say it is they create a more advantageous reality in order so that they can go back to work a little bit earlier. So they sometimes are not super accurate in telling us the day that the symptoms started. They may say that the symptoms started a few days earlier so as to be able to get back to work faster. So we choose to use a date that's nailed down in time. That's the test date, can't be fabricated. And so it's a lot of things that surround it. It's a constantly evolving program, and we look at evidence, at new information, and kind of hybridize our plans with newer iterations. Lori, I know it's a kind of complicated question and complicated answer. Do you have other aspects of that same question? Have I answered you?
No, that was fantastic. Well, we did just have the one that had a high temp, and when he followed up with healthcare, whatever their conversation was, decided not to test. But the strange thing was that the recommendation to stay off 7 days. Now maybe that was because he had been potentially symptomatic 7 days before that. I don't know. I just thought 7 days was kind of odd.
It's a constantly evolving program. The other thing is that our policies in Humboldt County have been, by my own admission, pretty conservative. We figure out what's safe and we make it safer. And the reason is our hospital it's a wonderful hospital, but it's relatively small and we have no redundancy. In Reno, there's redundancy. In most other communities, there are extra hospitals and extra medical centers. Humboldt General has a large burden, and we just try to make sure that we can keep Humboldt General as healthy as possible. And my feeling has been if Humboldt General were to be instantly inundated with a massive number of cases, they would have a really difficult time keeping up with demand. And so our primary strategy in Humboldt County has been to be more aggressive in prevention. That's one of the reasons